Welcome to Lexcura Clinical Insights, the podcast where clinical evidence, healthcare standards, and litigation strategy come together. I'm Michelle Carroll, founder and chief clinical strategist of Lexcura Summit. Sepsis is a time-critical emergency, and in litigation, time becomes evidence. The vital sign trend, nursing assessments, laboratory findings, MEWS or NEWS scores, provider notifications, antibiotic timing, fluid administration, and escalation decisions create a clinical timeline showing when deterioration became identifiable and how quickly the care team responded. When recognition or treatment is delayed, the central question is whether the warning signs were present early enough for timely intervention and whether the delay contributed to the patient's worsening condition. In this episode, I will explain sepsis recognition standards, the applicable 3-hour and 6-hour bundle elements, and how to map delayed recognition and treatment to patient harm. Did you know that every year, sepsis affects nearly 50 million people worldwide and claims over 11 million lives? That's more than the deaths from cancer, heart attacks, or strokes. Today, we're diving into why recognizing and treating sepsis within a 6-hour window is so critical and why it's still such a challenge.
Wow, those numbers are staggering. It's hard to believe something so common and deadly can still be so difficult to manage. So, let's start with the basics. What exactly is sepsis? And why is this 6-hour window so important?
Sepsis is essentially the body's extreme response to an infection. Instead of just fighting off the infection, the immune system goes into overdrive and starts damaging its own tissues and organs. If it's not treated quickly, it can lead to organ failure, septic shock, and death. The 6-hour window is critical because that's the time frame where interventions like antibiotics and fluids can make the biggest difference in preventing irreversible damage.
And that's where the SEP1 bundle comes in. Right. It's a set of guidelines designed to standardize the treatment of sepsis and improve outcomes. But even with these guidelines, compliance can be a real challenge.
Exactly. The SEP1 bundle includes steps like measuring lactate levels, obtaining blood cultures, administering broad-spectrum antibiotics, and starting fluid resuscitation. All of these need to be done within 6 hours of recognizing sepsis. It sounds straightforward, but in practice, it's anything but.
Right, because the real challenge is recognizing sepsis in the first place. It's not always obvious, especially in the early stages. A patient might come in with vague symptoms like fever, rapid heart rate, or confusion, and it's easy to attribute those to something less serious.
That's the tricky part. Sepsis can mimic other conditions, and its symptoms can vary widely depending on the individual. For example, older adults might not have a fever, but could show confusion or lethargy as their primary symptoms. Children might have very subtle signs that are easy to miss. It's a clinical diagnosis, which means it's based on a combination of symptoms and test results, not a single definitive test.
And that's where delays often happen. If sepsis isn't recognized quickly, the clock starts ticking, and the chances of completing the SEP1 bundle within 6 hours decrease. What are some of the main barriers to early recognition?
There are a few big ones. First, there's the issue of communication. In a busy emergency department, information can get fragmented. One clinician might notice a fever, another might notice low blood pressure, but unless someone connects the dots, the diagnosis can be missed. Then there are systemic challenges like staffing shortages, overcrowded ERs, and limited resources, which can all contribute to delays.
And let's not forget about the complexity of sepsis itself. It's not just one disease, it's a syndrome with a wide range of presentations. That makes it harder to create a one-size-fits-all approach to recognition and treatment.
Exactly. That's why education and awareness are so important. Clinicians need to be trained to recognize the early signs of sepsis, and hospitals need systems in place to support rapid intervention. It's also why tools like sepsis screening protocols can be helpful. They're not perfect, but they can serve as a starting point for identifying at-risk patients.
And patients and their families also have a role to play. Early recognition often starts at home, so knowing the signs and symptoms of sepsis can be life-saving. What should people be looking out for?
The most common signs include fever, chills, rapid heart rate, rapid breathing, and confusion or disorientation. There might also be signs of an infection, like redness or swelling around a wound, or symptoms of a urinary tract infection. But again, these symptoms can vary widely, so it's important to look at the whole picture.
So once sepsis is recognized, the clock starts ticking. Let's break down the steps in the SEP1 bundle. Why is measuring lactate levels the first step?
Lactate is a marker of tissue hypoxia, which means it can indicate that the body's tissues aren't getting enough oxygen. Elevated lactate levels are a red flag for sepsis, even if other signs aren't obvious yet. It's one of the earliest indicators that something is seriously wrong.
And then there's obtaining blood cultures. This step is about identifying the source of the infection so that treatment can be targeted. But it's also important to do this before antibiotics are started, right?
Exactly. Once antibiotics are administered, it can be harder to pinpoint the source of the infection. That's why timing is so critical. Broad-spectrum antibiotics are used initially because they cover a wide range of potential pathogens. Once the source of the infection is identified, the treatment can be adjusted to target the specific pathogen.
And finally, there's fluid resuscitation. This step is about addressing the low blood pressure that often comes with sepsis. Fluids help to stabilize the patient and improve circulation, which can prevent further organ damage.
It's a lot to manage, especially in a high-pressure environment like an emergency department. But the evidence shows that when these steps are followed, outcomes improve significantly. The challenge is making sure they're done within that 6-hour window.
So what can hospitals and clinicians do to improve compliance with the SEP1 bundle? Are there any strategies that have been particularly effective?
One approach is using sepsis screening tools or checklists to help identify at-risk patients. Another is improving communication through things like huddles or rapid response teams. And then there's ongoing education and training for clinicians. It's also about creating a culture where sepsis is always on the radar.
And it's not just about clinicians. Patients and their families also need to be part of the conversation. Awareness campaigns can help people recognize the signs of sepsis and understand the importance of seeking medical attention quickly.
Absolutely. At the end of the day, it's about saving lives. Sepsis is a formidable challenge, but with the right tools, training, and systems in place, it's one we can meet.
Well said. This has been such an important conversation. Any final thoughts?
Just that sepsis is something that affects everyone. Whether you're a clinician, a patient, or a family member. Awareness is key, and every effort we make to improve recognition and treatment is a step in the right direction.
Couldn't agree more. Thanks for the great discussion today, and thanks to everyone listening. Until next time, take care.
Take care. Thank you for listening to Lexcura Clinical Insights. A sepsis case must be reconstructed minute by minute. The analysis should align the patient's vital signs, temperature, mental status, oxygen needs, urine output, laboratory results, lactate levels, cultures, nursing assessments, early warning scores, provider communications, fluid resuscitation, antibiotic administration, and transfer to a higher level of care. The key questions are when sepsis first became clinically apparent, whether the findings were recognized, whether the appropriate response was initiated, and whether required treatment was delivered within the relevant time frame. A delayed intervention does not establish causation by itself. The strength of the case comes from showing that the patient's deterioration was identifiable, that the response fell behind the clinical urgency, and that the delay materially contributed to the progression of infection, organ dysfunction, or death. That is how the sepsis timeline becomes the foundation for breach and causation. For more clinical intelligence, litigation analysis, and practical guidance, visit LexCura Summit at lexcurasummit.com. I'm Michelle Carroll. Thank you for joining me, and I'll see you in the next episode of LexCura Clinical Insights.